Hi, everybody. I'm Dr. Shaila Sheikh, consultant endocrinologist from Sefi Hospital and HN Hospital, reaching out to each and every one of you on this wonderful evening. And good evening to each and every one of you who has logged in today to be with us on the 27th session of the 4D program, a program that tries to reach out to you so that we can understand better some of the nuances of medical management of some of the very common disorders like diabetes, hypertension, and to be able to give you the details and discuss and have a dialogue on these very, very prevalent disorders. And it gives me great pleasure, to dear friends, to be able to invite Dr. Alankar Tiwari, who is a fantastic consultant endocrinologist from Varanasi, and a warm welcome to you, Alankar.
Namaskar. Myself, Dr. Alankar Tiwari. I'm consultant endocrinologist and diabetologist practicing at Varanasi, Uttar Pradesh. And today we are here to discuss a very important and relevant topic of the challenges which we are facing in management of diabetes and hypertension in India. So we will begin our session. Yeah. So challenges in the primary care for diabetes and hypertension, that is at the base, the root level, how what challenges we are facing to manage the diabetes and hypertension. Not just manage, first of all, diagnosis, because diagnosing is most important aspect of any disease, and afterwards the management part comes. So next. So first of all, we will look about the diabetes, the burden of diabetes in India. And we all are very much aware of the status of diabetes in India. That is, around, the diabetes has become the capital, world capital of in world. Like comes at the number two. It ranks number two in the world as far as the number of people living with diabetes is concerned. And in India, you can well imagine that one in every 11 adults is living with diabetes. And currently, according to the International Diabetes Federation, 90 million people are living with diabetes. But sad part is that, and or unfortunate part is that, is still 53.1% of adults living with diabetes are undiagnosed. So as I've already said, that diagnosis is very much important part, and that has to be taken care of very diligently. That is, one in two adults of with diabetes are still undiagnosed, and the number of people with diabetes in India is the second highest in the world, as I've already told, and 40 million adults in India, they have impaired glucose tolerance. That is the stage which is called as the pre-diabetic stage, the stage just before the diabetes, when the pathophysiological mechanisms and process have already started, have already set in, and if it has not been taken care of, no intervention is done between this, it will place them at the high risk of developing type 2 diabetes in near future. Even in the stage of impaired glucose tolerance or pre-diabetes, the complications of diabetes, microvascular as well as macrovascular complications of diabetes, are supposed to occur. The rise in the number of people with diabetes is driven by a number of factors. It is a multiple factors which they interplay to in happening of diabetes, that are socioeconomic factors, demographic, environmental, and genetic factors. So a number of factors are there. Some are avoidable or modifiable, and some are non-avoidable, non-modifiable factors. For non-modifiable factors, we can't do much, but for the modifiable factors, we can do. And even for the non-modifiable factors, we can screen those patients who are at high risk of developing these diabetes as well as hypertension. And also, you can well imagine the gravity of this situation, that 747,000 deaths are caused by diabetes in the year 2021. So you can well imagine how grave the situation is. And the sad part is that, unfortunately, the people still are not much aware of this gravity of the situation, and they are not even paying attention, or they are not taking care of their diabetes and hypertension properly, appropriately. Next. Now, the hypertension in India, the status of hypertension in India, the hypertension is soon turning out to be one of the most lethal non-communicable disease, and it is you can say that 29% of people in India are currently suffering with hypertension, and 1.5 million people in India they have hypertension in the Southeast Asia. 1.5 million. So, and when we go for the urban and rural setup, differences in urban and rural settings, 33% urban Indians are there having hypertension, while 25% rural Indians are hypertensive. So you can say that 33 the urban population are having higher incidence of hypertension, but there are some confounding factors which we can discuss later. Then 21% Indian men are suffering with hypertension, while 22% women are suffering from hypertension. So there is slightly increased risk, incidence in females. So similarly, the deaths from hypertension is very, you can say, detrimental, and it can lead to various complications like coronary heart diseases, stroke, kidney ailments like kidney failure, hypertensive kidney disease, as well as hypertensive retinopathy, that it can affect your vision as well. And there are number of causative factors which affect the occurrence of hypertension in India, like age and age, gender, family history, genetics, as well as the your lifestyle. It is a very important factor. Alcohol intake, smoking, obesity, then the bad dietary habits, inactivity, that is sedentary lifestyle, as well as the stress, salt intake. So the most common factors which are prevalent these days, and which are the main culprits for the occurrence of hypertension in India, are the addictions, that is smoking, alcohol intake, bad dietary habits, and stress and lifestyle. So these all are very prevalent in India, and we can say that few decades, a couple of decades before, these the occurrence of hypertension and diabetes, the lifestyle related diseases, were more in the developed countries like US and Europe. But they nowadays developing countries are also having increased incidence of these things. I think this is due to the change in the lifestyle habits. We are now more turning towards the westernization of our lifestyle changes, and that's why the occurrence of hypertension as well as metabolic syndrome and diabetes, they are increasing day by day in India also. Next. Now, what challenges we face in the primary care of diabetes and hypertension? So, first of all, there is generally a lack of awareness about diabetes, hypertension, and its complication. As I've already said, that still the lack of awareness is there even in the remote areas, village areas, rural areas of the India. Also, in the urban settings, people are not much aware of the gravity of situation of diabetes and hypertension. They take it very lightly. And then the diagnosis and access to treatment for diabetes and hypertension, especially in the remote areas. So they are, first of all, people are not aware of these conditions. Then they do not have access, proper access for the diagnosis and treatment, to whom they should go and get themselves tested for these things and get themselves treated for this diabetes and hypertension properly. Then the economic disparity between the urban and rural settings. So it is well known fact that there is an economic disparity between these settings, which come as a hindrance for the proper care of these elements of diabetes and hypertension. Then there is scarcity of qualified healthcare personnel. It's a well-known fact. It is, you can say, an obstacle in the proper healthcare system in India, especially in our eastern UP. I can say that there is scarcity of qualified healthcare personnel, especially in the remote areas. So, due to these qualified healthcare personnel scarcity, people go to the quacks and non-qualified personals, and get themselves wrongly diagnosed or taking some other wrong treatments, which further deteriorate their and worsen the clinical situations. Then financial constraints are there also, which put patients at they prevent the patients from coming to the proper setting of doctors and healthcare facilities or taking the medications, and it also reduce the adherence and compliance for the treatment. Also, there are some social barriers regarding these disease. There are stigma, taboos, which are more prevalent in rural areas, and they prevent the patients for taking and seeking the treatment for these conditions. So these are the some of the common challenges which we face in treating the diabetes and hypertension at the primary care level. Next slide. Now, this continues. There is a lack of evidence-based decision. So these are also the challenges that a study showed that in the public sector there seems to be a greater need for strengthening the capacity to follow the available guidelines. So whatever the guidelines are available for treatment of hypertension, the diagnosis as well as the management of hypertension, it is not properly followed. So there is a need to strengthening the capacity. There is a need to strengthen the system to follow the guidelines which are available. And while in the private sector, communicating uniform guidelines, this could encourage their use to support the decisions of the healthcare professionals. So this there is a proper lack of evidence-based decision. And the next slide. Now, some other challenges to primary care. There is lack of communication between the primary healthcare professionals and patients. So this is very important. Lack of communication is very important hindrance and like obstacle between the proper diagnosis treatment of the patient. So there should be proper communication, proper counseling of patient regarding their ailments and how their management will go on. And since these are the chronic diseases, diabetes and hypertension are chronic diseases, and the treatment should mostly go lifelong. So the patient should be counseled properly at the initiation of therapy, at the time of diagnosis itself. Then there are lack of resources like the steady supply of medications, laboratory supplies, etc. This is very important factor. This is a very limiting factor in the proper health primary care, because many a times the supply of medications are not good, not enough. Laboratory medication supplies of reagents and instruments, they are not properly working. So these are also one of the obstacles for the primary care. Then there is inadequate information system that does not facilitate follow up and revisits. So there is the lack of follow up and revisits. Patients usually don't turn up after the initial visits. They don't adhere to the treatment. They keep on taking some medicine which you have prescribed initially, with despite their blood pressure levels, despite their sugar levels, they keep on taking the medication and don't turn up to the doctors for follow up or reassessment and reevaluation. So there should be proper information regarding this. A system should be there for this. They should be counseled and primed at their initial visit at itself. The importance of follow up should be taught to the patient itself at the initial visit. Then the poor support for self management. Self management is very important in the management of these chronic disorders, because this is a lifelong disease and patients should be trained to for the self management. So there is always a poor support for self management, and it prevents the proper treatment and management of hypertension and diabetes. Then the doctor centered care processes that impede adequate counseling. So, as I've already said, the counseling plays a very important role in the management and the long term implications of these disorders. So, a doctor centered care processes, it should be there for a proper counseling and priming of the patient at their initial visits, at the time of counseling, even at the frequent their revisits and follow up visits. Patients should kept primed, kept counseled, and encouraged for the treatment and maintaining the treatment, and should adhere to the treatment. That will further strengthen the primary care of these disorders. Next slide. Now, some strategies for diabetic patients with hypertension. So, what strategy which can be followed to have a proper management, proper care of these ailments? Like, first of all, which is very important and which should be done from the patient's perspective, from the patient side, and for this patient should be counseled very properly, like the being physically active. Physically active is the most important factor. Lifestyle is a very important factor and plays a very important role in management of diabetes as well as hypertension. So regular physical activity can lower the blood pressure and help manage the blood glucose levels, besides providing other health benefits. So whatever physical activity, whatever you can do, walking, swimming, cycling, skipping, whatever you are feasible with, you can do. So minimum of 150 minutes of moderate intensity aerobic exercise is recommended for a week, or 75 minutes of vigorous intensity exercise each week. Or you can say a 30 minutes of exercise per day is essential. Moderate exercise includes the brisk walking and swimming, and people should also consider doing some muscle strengthening exercises. So you can do 2 to 3 days of muscle strengthening exercises in a week, or while other day you can do cardio exercises. Then maintaining a healthy weight plays a very important role. So now you can see that these days obesity is also increasing very rapidly in all the age groups, right from the childhood till the geriatric population, and it plays a very important role in the causation of very other diseases like diabetes, hypertension, cardiac diseases, and other things. So for people with excess weight, losing even a little can help reduce the risk of both the high blood pressure and diabetes. So we say that according to the National Heart, Lung and Blood Institute, they say that even a 3 to 5% loss of body weight can improve the blood pressure reading. If you lose even the 5%, less 5% weight, body weight of your body, then there is drastic improvement in your blood glucose indices, blood pressure, and other things in your, like the obstructive sleep apnea. It is also due to increased body weight. So all these things, all these disorders will be come to the range, will be normalized even you lose 3 to 5% of your body weight. So maintaining a healthy weight is a very of the utmost importance. Next slide. Now, following a healthy diet. So, diet plays a very important role along with the exercise. And dietary limitations are often recommended for managing cholesterol, blood pressure, and overall well being. So, this typically includes eating plenty of fresh fruits and vegetables, focusing on high fiber foods, including whole grains, limiting added salt and sugar, and avoiding or limiting unhealthy fats such as trans fats and animal fats. So making a proper routine of diet, maintaining a food diary, and eating green vegetables, including all colored vegetables. Your plate should be full of colors. And as being an Indian, we all know that the diet which we take are rich in carbohydrates. So, and that is detrimental for us. So, increase the protein intake in forms of pulses and whole grains, dairies, etc., and include the high fiber diets like whole grains, cereals, high rich fiber fruits and vegetables. Salt and sugars should be limited, and unhealthy fats, like especially the trans fats and saturated fats, they should be limited in amount. So maintaining in the diet, you can save yourself from a number of lifestyle diseases. Then the smoking. We all know that smoking plays a such a detrimental effect on the body regarding all the body functions, right from the malignancies to the diabetes, hypertension, thyroid, and whatnot. So, tobacco smoking causes blood vessels to constrict, resulting in a temporary increase the blood pressure. The lumen of these vessels, blood vessels, got narrowed, and that it results in the increase in the blood pressure. And it also increases the buildup of plaque within the arteries, which can rupture anytime, and it can lead to stroke as well as myocardial infarctions. Tobacco smoking can also increase the risk of type 2 diabetes. Smokers with diabetes have a higher risk of developing serious complications like heart or kidney disease, because due to smoking they are affected. Retinopathy it also plays a very important role in occurrence of retinopathy, which is an eye disease that may lead to the blindness. There is poor blood flow, making infection and the risk of foot or leg amputation more likely. So people who smoke are more prone to develop micro as well as macrovascular complications of diabetes. Even peripheral neuropathy, which can cause nerve pain in the arms and legs. Even smoking also affects the blood flow as well as causes neuropathy, which can cause many other problems in patients of diabetes and hypertension, like erectile dysfunction in men. So, quitting smoking is of utmost important. Next slide. Now, the treatment strategies for diabetic patients. So, we now focus on the early intervention and early initiation of combination therapy, because we know about the legacy effect, that is, if the earlier the blood glucose levels are controlled, the effect of these blood glucose control, good blood glucose control, it goes for a very long time. So, a good memory is there in the body, in the cells of the body, and it is an approach to achieve the glycemic goals earlier and delay the deterioration of glycemic control, along with better preservation of beta cell function. So along with the glycemic controls, we focus on uh, postponing or halting the progression of complications of diabetes, as well as preserving the reserve of beta cells in our pancreatic islets. Now, there are some new novel medication therapies that are used with diet and exercise to control the high blood sugar in adult patients of diabetes. So these are DPP-4 inhibitors like sitagliptin, linagliptin, vildagliptin, SGLT2 inhibitors like canagliflozin, DAPA, and EMPA, and GLP-1 receptor agonist. Like they regulate and restore the incretin functions like liraglutide, dulaglutide, and semaglutide. Now, SGLT2 inhibitors, they act on kidneys, mainly they act on the SGLT2 receptors in the kidney nephrons and increase the glucose excretion in the urine, and thus decreasing the glucotoxicity. They have some indirect effects on the pancreatic cells also, so increasing the beta cell sensitivity, while DPP-4 inhibitors, they act on intestine and causes an incretin effect, increasing the GLP-1 levels in the blood, and they have also the dual pancreatic effects, increasing the insulin secretion and decreasing the glucagon levels. So combining these two drugs, there is decreased hyperglycemia, blood glucose levels are controlled, along with other effects, that is pleiotropic effects of also. SGLT2 inhibitors, they also cause weight loss as well as reduction in the systolic blood pressure, while the DPP-4 inhibitors are weight neutral. So the combination of SGLT2 and DPP-4 is a suitable option for Indian subset of diabetic patients for these very reasons, like they are safe, rapid, and have a very sustained glycemic control. They improve both the insulin resistance as well as the beta cell functions. They help reduce the body weight and blood pressure. So this is the extra glycemic benefits of this combination. There is a reduction in the pill burden, which is very important from the patient aspects, because this increases the compliance and adherence to the treatment. And overall, this is a cost effective method. So these are the benefits of this combination of SGLT2 and DPP-4 inhibitor.
My first question for you, Alankar, would be, something which is so relevant in our population. We have such a high incidence of malnutrition in our country. In spite of that, why is that diabetes and hypertension is so prevalent in India, which are supposed to be actually conventionally diseases of overnutrition or often associated with obesity or bad lifestyles? Please, Alankar.
Thank you so much for the question, ma'am. Actually, though there is very prevalence of malnutrition in our country, but nowadays there is change in the lifestyle pattern in our country, and due to this lifestyle changes, there is increase in the incidence and prevalence of hypertension and diabetes even in India. Like the eating habits of our Indians are, because the food habits, the large part of our food is of carbohydrates. Then there is sedentary lifestyle. We are more going to be dependent on the machines and technologies and becoming sedentary day by day. Stress is increasing day by day. Pollutions and endocrine disruptors are increasing day by day, as well as the obesity is increasing also. So all these factors, I think, they play a very important role in the increasing incidence of hypertension as well as diabetes in India, even after the malnutrition.
Thanks, Alankar. Thanks for that very eloquent answer, which very, very aptly describes that why are we as a nation grappling with this increased epidemic of diabetes and hypertension. You already alluded to it, Alankar, but do you think westernization has played a much bigger role in this increasing incidence of hypertension that we have in our country? Because hypertension is being diagnosed at a much younger age, much earlier, and more medication is required.
Yes, ma'am, I agree with this statement that westernization plays a very important role in increasing the incidence of hypertension, because as we have already said and discussed, like 2 to 3 decades before, the incidence of these non-communicable disease of hypertension and diabetes, they were more in the Western countries. But nowadays, there is a paradigm shift. Like in Indian South Asian countries, like in India, the incidence is increasing, and this is mainly due to the westernization in the eating habits, westernization in the dietary habits and lifestyle. Like we are more dependent, we are going for the technologies and becoming more and more sedentary, using vehicles, not, and we have reduced the walking and exercises, the and other things like using the junk foods, processed foods. These things have increased. So westernization has definitely put the Indian population at a risk of developing hypertension and diabetes.
I totally agree with you, Alankar. I think westernization has to some extent made a very, very big contribution in this increasing incidences of non communicable diseases in our country. And I think we need to definitely make some very, very concrete lifestyle changes so that we can actually, stem this epidemic that we are facing at this point of time. When we talk about our diabetic patients, we always say that hypertension and diabetic go hand in hand, Alankar. What is the prevalence of hypertension in our diabetic patients, and how can you actually prevent it? What can you do to make a difference as far as prevention is concerned?
Ma'am, actually, as far as the prevalence of hypertension in diabetes is concerned, so some studies they have shown that around 30 to 50%. It varies from the place to place and from urban to rural setting, but around 30 to 50% of patients of diabetes, they are suffering with hypertension also. And even in my own clinical practice, I've seen that around 60 to 70% patients of diabetes, they are having hypertension also, even the younger patients also. So hypertension and diabetes, they both create a very like we say, they are the double trouble. And to prevent this, we have to intervene at the earliest stage, at the time of diagnosis. So the screening is very important, and then control lifestyle management, like dietary habits, change in the dietary habits, change in the lifestyle, and other things, medications if needed. So all these things should be done in early phase of the diabetes. The intervention should be done at the earliest to decrease the incidence and prevalence and complications of hypertension in patients of diabetes.
I'm sure all the listeners have listened very closely to what Alankar has said regarding prevention, because we all know that prevention is better than cure. And if you can take that one step, you would be able to actually prevent these communicable disorders. We are now increasingly talking about gender differences, Alankar. We're talking about, diseases being different in women, different in men, much more data coming in much better understanding coming in about these differences. Do you think women are more prone to hypertension compared to men, or you really don't think that there is a real difference as far as that is concerned?
As the studies and other researches have suggested, in the younger population there is not much difference in men and women as far as the hypertension is concerned. But yes, post in the postmenopausal females, then incidence of hypertension increases. I think the reason can be sedentary lifestyle, eating habits, erratic eating habits, because the females in our country, they don't pay much attention to their eating habits. They eat whatever they are given, and they don't bother about their lifestyle and proper. They only take care of their family and family members, and count themselves in the last. So I think the eating habits, the stress levels, etc., they play a very important role in the postmenopausal females, and increase in the obesity and some other comorbidities like diabetes, osteoarthritis, etc. They also play an important role in occurrence of hypertension in these females.
What I also want to understand for you from you, Alankar, that when we are talking about this urban-rural difference as far as diabetes is concerned, or when we're talking about this urban-rural difference as far as hypertension is concerned, do you think it is poor self-management, poor support for self-management that is the cause of this urban-rural divide as far as diabetes and hypertension is concerned? Do you think that there's something we could do as far as that is concerned when we reach out to the population? Would there be some advice you would give or to all the listeners who are listening to you?
Yes, ma'am. I agree that there is a lack of self-support, self-system, and which creates a difference between this rural and urban in the context of hypertension and diabetes. Because even in the rural areas, there the patients are not aware of the self-care things, self-care, self-management of these things, and so they do not aware of the gravity of the situation, as well as the other things, the methodologies and the system how to take care of these elements at of their own. So they should be primed, they should be taught, they should be made aware of these things due to through various modes. Like we should be reach out, as you have said, that we should reach out to the patients through camps and other things, and make them aware about the self management, the importance of the self care in the rural settings of the patient. And thus I can say that the difference and this of urban and rural settings can be mitigated.
I think the listeners will really benefit from what you have just told them, Alankar. And I'm sure that your talk is going to make a difference as far as self management is concerned in these two groups. I have one last question for you, Alankar. That when we are talking about medication, when we are talking about, we're talking about diagnosis, we're talking about awareness, we're talking about complications. Do you think that we still tend to look at the wrong sources? Do you think that in spite of these numbers increasing, there is still a lack of actual? When I'm talking about actual, I mean to say genuine knowledge and awareness regarding these disorders in the general population. And you think that reaching out like this to the population by a popular show like this, a 4D show, would actually make a very big difference?
Yes, ma'am. Definitely, definitely. I totally agree with you that there is still a lack of awareness, and there are a number of. Uh, I think the not so good, not genuine, no sources of information available on the various social media platforms, and people are there from where the people in, especially in the rural areas, even in the urban areas, they get the wrong information about these diseases, the management of diseases, about the medications and the lifestyle management. So they get the wrong information from the various sources, and the number of authentic sources and for information are still low. And we have to increase, we have to do something to increase the awareness and to provide the genuine information, authentic information regarding the management, the disease process, the medicines and other lifestyle management of these hypertension, diabetes, and other diseases. And this can be done only through these reach out programs like the one which we are doing, like the 4D program and other things, the program on this similar setup. So this will benefit the patients and the people who are in the remote areas, to know about, to be aware of the things and the importance of the diagnosis, early management, prevention, and lifestyle changes for the sake of these diseases.
Thank you very much, Alankar. I think the entire dialogue that we've had today will make a very, very big difference to a number of listeners who logged in, and I am so happy to have had you on the show. Thank you very, very much for sparing your time and being with us. Bye, everybody, and have a great evening. Take care of yourselves. Stay healthy. Stay happy.
Thank you so much, ma'am. I'm also privileged to be here and having a discussion with you on such a very important and relevant topic. And I hope people will get benefited by this information. And thank you so much for this thing. A very good evening to all of you.